Educate. Celebrate. Connect. Arizona Hispanic Connection.
Welcome to AARP, Arizona Hispanic Connection, for another very informative show. I'm very excited for the topic today. Every first Thursday of the month, we do democracy. That's the theme. And then we address an issue related to democracy. This time is democracy in the healthcare system. We've done democracy in the three branches of government. We've done democracy in the school system. And now we will do democracy in the healthcare system. And we will be moving ourselves as the year comes, 2020, towards the election. You know, 2020 will be a presidential election year. And so we want to be kind of have this platform to address issues, to encourage folks to understand better our democracy, and more than that, to participate in our democracy. Today, as all our radio shows are being Facebook Lived. So if you do Facebook, find us at AARP, Arizona Hispanic Connection. Find us, like us, and recommend us. So again, democracy in the healthcare system. We have three special guests today, and I'm going to introduce them just from my left to, starting from my left. I'm very kind of not so predictable. Sometimes there's some protocols. You're supposed to find out who has like the biggest in the hierarchy of titles, you know, and it becomes kind of confusing sometimes, right? So you don't know who, you know, sometimes you have to call people the honorable and this and the other. So I'm very mindful of that, but a lot of times I said, you know what, I'm just going to start from my left and kind of keep it simple. So I have Guadalupe Sosa, and Guadalupe Sosa is, among all the things that she's been and done, is a member of the Arizona Adelitas. We've had her on the show before. This is going to be your mic. Get it as close to you as possible. Guadalupe, first of all, welcome so very much. You and Jerry Pastor have been helping us, have been helping AARP to produce the democracy shows. The democracy shows, I guess. You know a little something about democracy, and you've been involved. So thank you so very much. And first of all, welcome. How do you feel about us addressing this theme of democracy and today in the healthcare system?
I think it's very important because in the healthcare system, there's so many aspects that touch us. One is the care that we receive from babies all the way to the elderly. And in our community, sometimes the elderly are not as well taken care of. That particular community not taken care of as well as other communities, especially because of the lack of money, the lack of the language sometimes, the lack of not knowing the system. You know, we do have a not-for-profit hospital, and I think that sometimes even they may get caught up in some red tape. The other thing is if we are mistreated, you know, by a doctor, there is a board that takes care of all the doctors who can slap them on the wrist or take away their license, and they're appointed by the governor. But again, it's who is elected that then goes on these different boards. And there have been some instances where a doctor merely receives a slap on the hand for some really serious damage to an individual. Mm-hmm. So it's important to know all the different aspects. There are clinics that are run either by the state or the federal government. They also get monies to know where we can go. There are dental clinics that sometimes visit school districts, and it's important that, especially with good dental health care, also if you're not taking care of your teeth and all, it could lead to other serious health problems.
So basically what we're trying to do here is bring democracy from the heavens to the earth. Oh. I think, and democracy is all over the place. I mean, sometimes we think it's just in Congress, but as we saw in a past show, it's in the school system, mm-hmm. and now we're going to see how it is also in healthcare. Now let me see if I can get it from memory. Jana Lynn Granillo?
That's correct.
Perfect. Jana, I've seen you around, but I'm so honored to that we can have you on the show today. I know you've been involved in healthcare pretty much, well, let me say, many years. So first of all, welcome. And could you tell us just a little something about yourself? You know, I think, first of all, I need to say thank you for your service. You are a Latina veteran,
Thank
correct?
you. You're
Thank
welcome.
you so very
Thank
much.
you.
Take a couple minutes to kind of tell us who you are, where you've been, the experience in professional, you know, your degrees, your positions that you've occupied in healthcare, and then some of your service to the country as well.
A little bit about myself. I was born and raised here in Phoenix, Arizona. I live in Tempe. I'm a graduate of Carl Hayden High School. I'm a United States Air Force veteran. I'm an ASU alum. And I'm a retiree who had a career in state service of about 25 years. I worked at the Department of Economic Security and the Arizona Department of Health Services, from which I retired from. I am a two-time commissioner for the city of Tempe. I serve on the Neighborhood Advisory Commission and also on the Census Commission. I have a daughter who's a junior at ASU that I'm very, very proud of, and a husband who also is an active person that helps me, supports us so I can go out and do advocacy work. I think for the healthcare, my first experience in healthcare was as a United States Air Force airman. And I was trained as a nurse's aide and then was subsequently trained as an occupational therapist assistant. So when I got out of the military, of course, I was still interested in the system of healthcare and wellness, and went to ASU on the GI Bill and got my degree there. So I've been dabbling in and around healthcare for many, many years, over 30 years. I retired from the Department of Health Services in 2010 and became a full-time advocate in that arena and also in the arena of Latinos. They came back home and met your guest today here in works that we did with eLatina Voices in bringing awareness to Latino issues and leadership development for the youth.
So would you say that Jerry Pastor did a good job in bringing you to the show? Do you see a direct link between democracy and healthcare?
Oh, absolutely. And if you look at what the main issues are right now, healthcare is one of the number one issues, and it's a divisive issue on what it is and what it should be. But I'd like to bring attention at this show as to some of the work that I did in public health when I worked for the Department of Health Services. And public health is pivotal in turning the corner on what we do in healthcare. Because if we don't do public health, which is preventing illness, then our costs will be farther down the road in healthcare.
And can we say that public health is pretty much more than just access to care, and then it's also very much linked to people who make decisions about these matters, and that's where democracy comes in.
Democracy comes in policy decisions that people make in our state system, in our federal system, in our local system as to things that impact public health. Public health, it's hard for many people to understand unless something goes wrong. If you get sick from eating something, if you go to a healthcare facility where they're not doing what they're supposed to and there's some damage to people who are in that healthcare facility. To be extreme during the Ebola crisis, who's during the surveillance for that, and what are the mechanisms that we have in place to not only surveil diseases that are going on out there, but to treat them and to prevent them. And vaccines is a big hot topic right now for prevention, and it's so important for older adults to get their flu vaccine because of of the vulnerabilities that many older adults have.
Jerry, if you don't mind, can we wait after the break to come
Of course.
to you?
Yes.
We already are up for a quick break. Stay with us. This is AARP, Arizona Hispanic Connection. We will be taking a short break. The topic today is democracy in the healthcare system. Stay with us. We'll be right back. Thank you. Thank you for staying with us. This is AARP, Arizona Hispanic Connection. The topic today is democracy in the healthcare system. On our first show, we emphasized that democracy, in many instances, we always think of democracy and kind of link it to Congress, electing a president, electing legislators, electing senators, and then the president takes care of the judges and the process of the selection and confirmation of judges, etc. So meaning the three branches of government, we sometimes kind of focus on that. Mm-hmm. And we make a big splash about presidential elections, etc. But on the second show, we saw that democracy, which is a government, I love these words by Abraham Lincoln, a government of the people, by the people, and for the people. Amazing words. And then we saw in the democracy in the school system of how there are positions on boards, the superintendents and board members that are so critical to how education will be offered. And we saw how important that democracy plays a big role in having key persons, having the right persons in the board, primarily the boards. So today it's healthcare system, right? It's very interesting. I was talking to my wife actually, and do you remember where they were trying to do away with the Affordable Care Act? That
yes.
Congressman Senator McCain, late Senator McCain, he gave a thumbs down to give his vote so that the Affordable Care Act would still stay in place. So that's an amazing, that's a history there. And we saw how that act is an act of democracy. There was a person in the right spot at the right time making a decision to uphold a law, the Affordable Care Act. So that's kind of like an example in how critical it is. But today we want to bring it to healthcare, to the healthcare system. Now let's come to Jerry Pastor. Jerry, again, thank you very much for working with AARP as a member and a leader of the Arizona Adelitas and putting together these shows on democracy today in the healthcare system. Welcome. Thank you. And tell us, your feelings, your thoughts about the democracy in the healthcare system.
Thank you. Thank you very much. I'm excited that Adelitas can continue to do our work, and we do it in many ways, not only supporting people in leadership positions and helping the youth to move forward, but we really want to be a part of helping to educate, motivate people, to tell them how important they are, because each of us are so important in our neighborhood. We have to be there for ourselves and for our neighbors. It really is kind of the old way I was raised. I was born in Phoenix, Arizona, and raised in a barrio right next to the airport. And I can remember my mother, who was a precinct committee person, went and knocked at every door to make sure democracy was happening. And she did that, and people would come to her house and record that they had voted, because they knew my mother would be calling them again or walking to their front door to explain. And I learned that alongside her, and it was exciting. But I also was a young girl where people would say, "Se fue el condado." And it was like, he went to where? He's in the hospital. He's in the hospital, but he went to the county. And you'd say, oh, because you didn't know, and you thought that the old county hospital we knew was way out on 35th Avenue, and when I was a girl, that was a long way away. And it wasn't necessarily in a structure that was very pretty. You didn't see anything. It wasn't safe. It was right next door to the jail. And we would go see my tias. We would go see my cousins. There were lots of people. We didn't understand that Maricopa County Hospital had a board and that we elected them. Even my mom was not aware of that. She was aware of the traditional kind of your representative, your senator, your board of education, but she didn't really know the county system, the county health system. So as we see and as we grow, the county became more and more affluential into changing the Maricopa County Hospital. If you look at Maricopa County Hospital today, it has a very good structure. And secondly, if you are in a fire or damaged with fire burns on your skin and your body, the first place you want to go in Arizona is Maricopa County Fire Burn, because they are the #1 trauma center for fire burns.
Amazing. Now, Jerry, we had Mary Rose Wilcox scheduled to be here with us, and you obviously know that the board, and we'll come back to Jana a little bit on that board structure, because I think that's super important to explain. She couldn't be with us today. Why did you pick Mary Rose Wilcox to address this matter of healthcare system and democracy? What's behind that?
Mary Rose Wilcox, as you know, is a county supervisor, as a city council member. Well, she's now on the Maricopa County, help me, Jana.
Maricopa County Special Healthcare District Board.
And some of you voted for her because she is in a district that elected her. So she sits on a 5-member board and makes decisions. I'll tell you the one thing she did recently that is just outstanding. When Abrazo dumped Maryvale Hospital, and I mean they dumped them overnight, they gave them 2 weeks' notice or something just ridiculous. They closed the hospital. Because Mary Rose sat on that board, the board met, and immediately she said, we must buy that hospital. So Maricopa County
Special Healthcare District.
Maricopa County Special Healthcare District bought Maryvale Hospital.
That's how crucial it is for having the right person at the right
place
positions,
at the
which
right time.
Basically, it's democracy.
And you who are listening helped make that possible because you elected her to office. Who would know? Who would know that she would get to be so influential in making that decision?
Can you elaborate on that, Jana, and basically explain to us and to the audience this board? To be very frank with you, I had no clue about that.
Many people don't understand that. The Maricopa County Special Healthcare District Board is, it mirrors, it is not part of the supervisory board for Maricopa County, but it mirrors the board structure in as far as the election, the districts. In Maricopa County, the supervisory board, you have 5 districts. The Special Healthcare District Board, you have 5 districts as well that mirror that same geographical location. They get elected every 4 years. It's, if you look on those people who own property, if you look at your property taxes, one of the secondary taxes on there is the Special Healthcare District Board. It's a special tax district that property is taxed on that helps support that business structure. People know of that board as of MIHS, Maricopa Integrated Health Systems, which recently changed their name to Valley Healthwise. So it is a healthcare system that has hospitals, behavioral health hospitals. It has clinics around the valley. It has the burn unit. They have a special teaching hospital in that structure. It's a very important part, safety net program for the county and for people who have insurance and people who are on access and people who have no means to pay, but they go to a clinic on the special sliding fee schedule, whether their ability to pay or no pay, they can be seen. So it's very important for our community.
And so when we talk about health care, like say the Affordable Care Act, is there any correlation? Medicaid, perhaps the Access program. So what are we talking about here?
It's very, very complicated. And even many people in my colleagues don't exactly understand. And I've come to understand it over the years. And there's a lot I don't understand. But the Affordable Care Act allows the Medicaid expansion, for one thing.
Okay.
It also allows for the marketplace, where you can buy into the marketplace.
Right.
So given the pay mix that the county has, they have a pay mix that is both of people who are on Access, which is your Medicaid, which is your Affordable Care Act.
Right.
Okay, so that's very important in their ability to run a business. So that's an important component of their. It's not the only thing that they use, but it is an important component of their ability to stay afloat and to run the business.
So what are the decisions that the board, this board for the Maricopa County Special Healthcare District, which was MIHS, which is now Valley Health Wise. This is a board. This is an important board that has to do with healthcare in Maricopa. What are some of the decisions that they have to make? Do you have a comment or question?
No, there's two different boards.
The Maricopa County Special Healthcare District is the board for MIHS, which is now Valley Health Wise.
Oh, okay. So there's
So,
all right.
Yeah.
So some of the decisions, because you mentioned one, the purchase of a hospital.
Yes.
How crucial was that decision, and what are other decisions that need to be made, and that in this case, I assume that Mary Rose Wilcox is the only Latina in that board. Is that fair to say, or do we know if there's any other Latinos?
She's the only Latina I know of.
So explain to us a little bit about the different decisions that need to be made or have been made, and how important it is that a Latina or Latino sits on that board.
I think it's important to have a Latino or a Latina because they understand the community, a primary community in which they serve. So the demographics of who they serve, you need to have somebody who is sensitive to that. But as far as all their decisions, I really can't speak to that as an observer on the outside. Of course, they made decisions on their plan of where they're going to have clinics made, built, where the hospital, what they're going to do. They're rebuilding the hospital, what they're going to do, what that looks like. Behavioral health is a key component, making sure that they have services to provide for beds, which is we're lacking in that in our state, to make sure we have enough behavioral health care beds for evaluation.
Behavior health is mental health.
Yes.
Yes.
Right. Let's steal another minute. I know we need to go on our break, but so when are they elected? How often?
There's 5 board members. Coming up in 2020 will be an election for 3 of them, I believe.
Okay.
And then and they serve 4 years. So in another couple of years, they'll have an election for the other 2 board members.
So they have to run for these positions.
That's correct.
They have to campaign.
Yes.
So folks, when they run, I'm sure that when they give speeches and they explain the importance of this board and the importance of these positions, correct?
I would hope so.
Yeah. Let's take a break, and we'll come back to explain the difference between having access to care and having the concept of a broader system focus on prevention, not just taking care of a condition, but preventing. And I think that's where you come in, the public health concept. And then, obviously, we're going to link it to democracy. Stay with us. You're listening to AARP, Arizona Hispanic Connection. The topic today is democracy in the healthcare system. Stay with us. We'll be right back. Thank you. Thank you for staying with us. This is AARP Arizona Hispanic Connection. The topic today is democracy in the healthcare system. The more we address these topics or this theme of democracy, the more I like it, the more I see it very practical. You know, a lot of times we see democracy and sometimes even people they associate it with politics, right? Are there two different things, democracy and politics, anyone, would you say?
They are and they're not. I mean, they are in that you elect people to boards that govern these. So, and they must run for office, but they are not a party system. You don't run necessarily as a Republican or a Democrat, or independent. You are really running for the position and the authority that position gives you.
So is democracy softer? Do you think it scares people less than when they hear the word politics? Because I love now, democracy is the government by the people. I'm sorry. Yeah. What is it called? Government of the people, by the people, and for the people. That's literally democracy. That's the meaning of democracy. But a lot of times we don't understand this word, and now we're kind of understanding how practical it is. It's part of our daily lives. You know?
I think it's interesting that you bring up that question, because I think many of us use that as an excuse for not voting. Oh, it's all the politicos. They do the same thing. Oh, it's so-and-so, and I'm tired of her. Really? If you're tired of her, then vote. Find someone else to do that. These decisions are made, and they impact your life. Remember, we had the school board and all of those things that happen.
Right.
Now we're talking about health. And, you know, if you call 911, the fire department gets to decide what hospital you're going to. It's not you.
Okay.
So you can end up at Maricopa County.
Right.
None of us don't have family who don't know or need a clinica once in a while, whose time has been unemployed. I know I've been unemployed and had to have that kind of service. It's just part of the everyday world of making it in our city. Right. And it's important that we understand where those things come from. And saying, oh, es la política. Well, no, it really isn't. It's democracy.
And a lot of times the rhetoric, I guess, is what brings negative elements to the concept of politica or politics.
Yes.
Politics is part of democracy in the sense that, you know, it's of the people, by the people, and for the people. You need elected officials. You need to elect people. We have a representative democracy, right, where we don't all vote for every single issue. We basically elect people to do that. Jana, would you mind now bringing us to this concept of, the what is it called? The organization. What is it called? The
World Health Organization.
World Health Organization. Thank you. Through an organization, a local agency, I came to know about the social determinants of health, which is an amazing. I mean, honestly, I don't know, when you were exposed to this concept, but it hasn't been that long that I personally was exposed to them. And they're just an amazing concepts. They come from, I believe, the World Health Organization. Can you help us move from access to care? Because a lot of times when we talk about public health or healthcare, our brains habitually just go to, oh, I need insurance. If I have insurance, I got it. But public health is more than that. Can you help us understand that?
Public health is community health. It's population health. It's about the prevention of disease. It's about wellness. It's about safety and assurances. Safety and assurance is a facility. Who licensed that for whatever the requirements are. The prevention, you need somebody to do the surveillance, to look at the data and to compare that data to the population. Is this significant or is it not, as far as diseases occurring or illnesses occurring? And public health is about, well, it is in the school too. You think about your school nurse. Go to the board. Do you have a school nurse? They're usually the first line of defense of what's happening. and that's definitely at a local level. Your environment. You know, people think about the air quality, and climate is a hot topic today. Your environment, the air quality affects asthma. Vaping is a big issue in schools right now. It goes on and on. Usually, what hits the headlines is something going wrong, but when things are going right, public health is kind of silent. Social determinants of health. I don't know where that came from or how long it's been, but in my recollection, it's fairly new. And if you think about those things that we need to stay healthy, we need a job. If you have a job and you need to stay home, are you going to get paid for sick leave so that you don't go to work and spread all the, or are you going to send a sick child to school and they're going to get sick? The housing is a huge issue right now. If you don't have housing, then you certainly don't have health. Food and nutrition, if you don't have access to food and nutrition, and they talk about food deserts that you have right now, you know, is there a local market close by that you can go to, and do they have fresh food, you know, fresh foods and vegetables? There are some programs in cities where they have vans that go around to libraries that sell fresh fruits and vegetables. So, you know, what can we do to tighten up those social determinants of health so that we stay healthy? Education is huge. Those people that are educated have a tendency to have a better health outcomes or are healthier. So the social determinants of health are fundamental to a system for people being healthy. And we certainly don't want to pay for the health at the sick end. We want to do what we can to prevent it and pay, you know, where they say an ounce of prevention is worth a pound of cure. So we want to pay for it where it's cheap.
Right.
Okay, and it makes us life better.
Who deploys? Who talks about this? Who takes care of this? The county?
It's at the local level. It's at the city level. It's at the state level. It's at the federal level. It's at the county level. At the local level, you think about zoning that's occurring, and they'll send out notices. We're going to have an XYZ hearing on this particular business. Do we want another liquor store? Do we not have another vaping? Texting and driving, that's been from city to state to make sure that, you know, we try to do what we can for injury prevention, because people are having accidents on the road. That happens at a local level. It happens at a city level. It gets debated at a state level. Funding for looking at what preventing injury happens at a federal level, CDC. Funding the healthcare systems to make sure that we have doctors happens at some of it happens at a at a federal level. HRSA, Health Services. I get my initials mixed up, but HRSA. You know, to make sure that we have a workforce. So it's all over the place.
You know, let me throw a question at you because it's going to be a difficult one in a sense. How do you three keep track of elections? I mean, how do you know the things that are on your radar and keep track? Because it's a lot. It's a lot of elections, a lot of moving parts in the democratic system in a local level. So how do you have a list in your brain? Do you have a list somewhere at home? How do you know about? Because if someone wants to keep track, wants to be very, very into the democratic process, I mean, is it over the years that you kind of become aware?
For me personally, I belong to different professional organizations who keep track for me.
Okay.
So they're monitoring what's happening at the federal level. And those professional organizations are focused on, they have different focus areas. Maybe they have access to health care as a focus area. Maybe they have prevention as a focus area. Maybe they have the social determinants of health as a focus area for housing, that sort of thing.
So
I don't do
like
it.
Something automatic, that like a train, and you just kind of hop on that train and it's kind of taking you. How about you too? I mean, it's because sometimes I feel like we're asking folks too much. You know, the people who have sometimes two jobs, and after the jobs, you're supposed to be, in the democratic process. I mean, it sounds almost like too much. So I was wondering how you do it.
That's interesting because it is tough to keep informed in your neighborhood. I think your school board probably turns up at your door.
So you can start in the neighborhood.
In the
you can
neighborhood.
go to the school.
I think there's many ways of just reading. But when you ask people who have two, and unfortunately we have people a lot who have three different jobs. Many women are in that category. So it is people like us in our commitment to Arizona Adelitas that we try to educate and to keep informed and not to be bad about what they can do, but to be proud that they're listening to you, that they want to do something. And we bring that hope and we empower. Our Guadalupe Sosa loves to say, one vote, one power, the power of one. The power of one.
So, Guadalupe, help us. How do you do it? So you start at the neighborhood level, the school level, and then what? I mean, how do you keep track of all?
As Janice said, sometimes you belong to different organizations, and they will say, "Here's what's coming up: propositions, or the legislature, the Congress, congressional elections." But once you get registered, then you are sent by the county. All registered voters are sent information ballots or information booklets. And so, but every year I do my appointments on the phone, but I also write them down. And every year I get a new calendar, a small one, and I start looking on it. And every second Monday of November will be in italics, election day. Go, there's going to be an election. Okay, in November. Well, we all know that, but sometimes you get busy, especially around that time. But so there's all kinds of ways out there. But once you get registered, you get all that information. Everything from we recently had the I already forgot it, and I went down to the county recorder's office, elections department to vote. We just had the
school board,
the overrides and the bonds. Yeah, the
bonds.
overrides, senior moment, overrides and the bonds. And so all of a sudden that information booklet came in and that's right, we got to vote for that. And so then when the bigger elections come, they will have, we have now the voter information pamphlets, a real thick one that tells you about every candidate with their pictures, and you go through it and read. So from the day you are registered to vote, you will start getting information about election. Unfortunately, they come like maybe a month before.
Yes.
But yeah, we all know there's something going on almost every November.
And the propositions as well are in the ballots, the information. And you'll get information on people will weigh in on those ballots from different organizations that say they support this or they don't support it. And I always look at, for those people who are supporting or not supporting, who is that? And do they have another agenda, or what's their agenda that they're trying to push? So you have a way of seeing that.
We should probably do a radio show on this very issue, on how to walk through or identify the different arenas that require our participation, especially in voting. From maybe the neighborhood, the boards, the school boards, the districts, the congressmen, the senators, so many. But
the good news is in December, if you listen again, we are going to have some folks who will help you walk through some of that process.
Let's do it then.
Yes, we should be able to.
Let's take our last break. You're listening to AARP, Arizona Hispanic Connection. The topic today is democracy in the healthcare system. Great conversation, by the way. Stay with us. We'll be right back. Thank you. Thank you for staying with us. This is AARP, Arizona Hispanic Connection, a platform that educates, celebrates, and connects communities. And the topic, the theme, I'd like to highlight the theme of every first Thursday of each month all through 2020 will be democracy. We do the English show on the first Thursday of the month, And then the following Tuesday, we come back to do the Spanish show. And let me just let you know that beginning in 2020, we will no longer have the Thursday English show as a standalone. We're going to just have the Tuesday Spanish. We're going to cut it in half. We're going to do 30 minutes Spanish, 30 minutes English, same day, same topic. I think that'll probably be better. Hopefully, that'll be better. Again, we have Guadalupe Sosa with us from the Arizona Adelitas. We have Jana Lynn Granillo actually all three of us are from the community. We own you. The community owns you. You not one entity necessarily. And then obviously Jerry Pastor. Jerry and Guadalupe from the Arizona Adelitas have been so helpful in collaborating with ARP to produce this shows under the theme of democracy. So we're very thankful for that. As AARP and as personally, I am very thankful because Thursdays are becoming, the first Thursday of each month is becoming a lot easier for me because other than that, I have to put it together and look for the guest and the topics. And like today, Jana sent us the good, actually like 4 or 5 questions that were very, very good in kind of leading the conversation. So we only have a few minutes, and so we've moved from, trying to bring democracy from the heavens to the earth, making it very practical. Let me just throw in the question again. So in this sphere of what you just spoke to us, Jana, of health, public health, not just access to care, but prevention. Where are we in prevention from the standpoint of community? Are we getting it?
I don't know if I understand what you're
In other words,
asking.
are people realizing that health is not just having insurance, but also taking care of their eating, and then from the government side, providing places for walking and transportation and all that good stuff that you just...
I don't know if they put that together, but that certainly is part of, public health. What we do in our systems, walkable communities. Can you cross the street without getting run over? Are we pinned into a certain area because we can't get out? Walkable communities, getting the physical activity. I'm a big proponent of parks. I think our parks are treasures where we can join in community and get physical activity. You see, people are making businesses off of nutrition. Mm-hmm. Absolutely. And they're making businesses off of getting physical activity with all the, Fitbits and all sorts of technology that's out there. I don't know if people are putting that together as that's part of public health, but building that infrastructure certainly does affect our ability to be healthy. And certainly that's a value that everybody has.
Have you two heard about this concept before from the social determinants of health?
Yes, I think I have slowly, and it really started in Phoenix, mostly from young kids, because we were really doing programs for them to, for instance, to cover their put fluoride on their teeth very young, so that they weren't getting cavities because it's so expensive, and so. I didn't do that as a child in grade school, and it's very important that it start early. So I think in the last 10 years, you've really seen these young people come up. I have to say I was shocked when...
More healthy behaviors?
Healthy behaviors. You see Latino food now. It comes in different ways, and you can say gluten-free, you can say non-fried, you can have tacos that are healthy, fish tacos, that isn't fried. So I think we're becoming very aware and some responsible. I look back, though, and think that my grandparents ate more healthy because they ate from the farm. And so, my grandma made her beans and they were whole. They didn't fry them. Right. It was very interesting to see. I think we're taking that on more and more in our communities. I walk with AARP.
I saw those pictures. You
I
and
walk on the
Guadalupe with
canal.
Our State Director Dana Kennedy.
Yes,
Yeah,
we
yeah.
were walking the canals, and we were
Right.
bringing more people to do that. And as you progress with putting a certain location for Latinos in different parts of the city, we're going to be able to start up our walks with other people, and it's fascinating. It's lovely. We
Do you
talk.
think we can put together that for Latinos? With maybe on a neighborhood or something.
Absolutely.
We should work on that.
Yes.
Let me come back to Jana, and because if we do not bring the social determinants of health, public health holistically into the picture, I have to believe that that's going to put a financial strain on the government. Am I on the right track on that? Because it's not just having health care. Because if I go to the doctor just to treat a condition, but I'm not preventing, in the long run, it will be more costly for everyone.
It is more expensive to treat it at the sick end versus at the preventative end. And also it makes sense to have funding from the federal government and from support all around at the preventative end, to invest in our parks, to invest in funding for CDC. If you look at the access budget, well, first of all, access, I looked at a few data points to see if it was still true. And it's still true that access pays for more than 50% of the births for Arizona. But access is Medicaid.
Right.
Okay. And that, if we're sick, if we're paying for sick care, that's going to cost them more in providing care for all those people who are on access. The budget alone, the state of Arizona, and I glanced at it again before coming, I believe for 2020, the access budget is like $2 billion. If you look at where the budget is for the state, it's Department of Corrections, education, access. Those are the top big ones. Right. And most of the funding comes from the federal government. So, yeah, it is costly. And that's the $2 billion is the small end. The feds pay for the bigger end of what that is to support.
In closing, where are the spots, the places, the decision makers in all this? So let's bring in the concept of democracy. So, okay, we brought in the health, public health, all that, the Maricopa system, etc. So what are the positions of power that we as a community need to be mindful so that when the elections come, when people start running for positions, where can we locate those key positions that are key, are important, and that we would love to see more Latinos run and occupy those positions? What are those positions?
I would say they're at every level.
Okay.
They're at the school board. Do you have school board that supports correct information regarding prevention for pregnancy?
And we're losing nurses in school budgets all the time.
Nursing,
they're critical.
School nurses, your city, are they looking at walkable communities? Are investing in the parks? The legislature, are they supporting those bills that support the social determinants?
So it's
of
difficult
health?
to
It's
just
everywhere.
pinpoint at
no,
one
it's
area.
It's all across.
And that's why, Guadalupe, it's very important, this efforts to educate, to basically inform folks, because we're hitting, elections come at you from all directions, right? So we kind of have to have a better understanding of all that it entails and somehow make a list of, somehow put them on our radar so that we can participate.
Right. Well, what's unfortunate is our community either doesn't have access to the information, maybe lack of computers or whatever. For me, for example, I'm on Medicare, and so the first broker I went to, it didn't work out, and then I stayed with him a year or two, went to another broker, didn't get the information. I didn't understand A, B, C, and D. To me, they're letters in the alphabet. Finally, I get this young Latina, and if I could mention her name, I would, but I can't. Finally, I understand it all, and that's because I kept going and going and looking. And, my mother was like, yo no sé qué voy a hacer, A, B, C, D. And it was confusing for her. And so it's the lack of information that doesn't get out there. And like I said, I've got a young lady now who knew the insurance backwards and forward.
Right.
And so that's having that access, me being able to go here, I don't know if you, but getting every insurance company was sending me brochures.
Of course.
Finally reading it all and sitting down and taking the time. And our community doesn't have that access.
So we need to keep working on educating our communities. Guadalupe
Correct.
Sosa, Jana, Lynn, Granillo, Jerry Pastor. Thank you so very much. We run out of time. We'll keep doing these shows. I think they're very informative and important. So thank you very much again for joining us. And thank you for joining us today. We will see you next time. Have a great day.